Half of us deal with it, yet most of us don't understand how it works. Can you guess what it is? Half the population experiences the menstrual cycle every month, but surprisingly, many people don't actually know how it works. The menstrual cycle is a natural biological process that prepares the body for a possible pregnancy each month. The average cycle lasts about 28 days, though cycles between 21 and 35 days are also considered normal. If you are new here, hi, and welcome to my channel where we learn a little bit of everything all of the time. Make sure to like and comment if you learn anything new. The menstrual cycle begins on the first day of menstruation, and it moves through 4 main phases controlled by hormones. Those phases are menstruation, follicular phase, ovulation, and the luteal phase. Let's break down what happens during each one. Phase 1, menstruation, days 1 to 5. The cycle begins with menstruation, also known as a period. If the egg from the previous cycle was not fertilized, meaning you did not get pregnant, the body no longer needs the thick lining of the uterus that was prepared for pregnancy. So the uterus sheds this lining, which leaves the body as menstrual blood. This is what causes the bleeding that typically lasts around 3 to 7 days. During this time, levels of estrogen and progesterone are low, which signals the body to start a new cycle. Many people experience menstrual cramps, also called dysmenorrhea. These cramps happen because the uterus is a muscle, and during menstruation, it contracts to help shed its lining. The body releases chemicals called prostaglandins, which trigger these contractions. Stronger contractions can temporarily reduce blood flow to the uterus, which causes pain or cramping in the lower abdomen. Phase 2, follicular phase, days 1 to 13. At the same time menstruation begins, the follicular phase also starts. During this phase, the brain releases a hormone called FSH, follicle-stimulating hormone. FSH stimulates the ovaries to develop several small sacs called follicles, each containing an immature egg. Usually, one follicle becomes dominant and continues to mature. As the follicle grows, it produces estrogen. Estrogen helps rebuild and thicken the lining of the uterus, preparing it in case pregnancy occurs. In the early stages of the follicular phase, it is common to feel cramping, tender breasts, and bloating. Though in the later stages of the follicular phase, the symptoms are vastly different. The most common effects include improved mood and cognitive function, and increased energy, confidence, and libido. Phase 3, ovulation, around day 14. Around the middle of the cycle, ovulation occurs. Ovulation is triggered by a surge in luteinizing hormone, also known as LH. This hormone causes the mature follicle to rupture, releasing an egg from the ovary. The egg then travels into the fallopian tube, where fertilization can occur if sperm is present. Ovulation represents the most fertile time in the cycle because the egg is available to be fertilized. It is important to be careful around this time. However, the egg only survives for about 12 to 24 hours after being released. During ovulation, it is common to feel an increased sex drive, have clear skin, or even experience light cramping. Phase 4, luteal phase, days 15 to 28. After ovulation, the follicle that released the egg transforms into a structure called the corpus luteum. The corpus luteum produces 2 important hormones, progesterone and estrogen. These hormones help maintain the thick uterine lining, creating an environment where a fertilized egg could implant. If fertilization occurs, pregnancy begins. If fertilization does not occur, the corpus luteum breaks down. This causes estrogen and progesterone levels to drop. When those hormone levels fall, the uterine lining is no longer maintained, and menstruation begins again, restarting the cycle. The hormones that control the cycle. Several hormones regulate the menstrual cycle. GnRH, gonadotropin-releasing hormone. This hormone is released by the hypothalamus in the brain and signals the pituitary gland to start the cycle. FSH, follicle-stimulating hormone, stimulates the ovaries to develop follicles and mature eggs. LH, luteinizing hormone, triggers ovulation, releasing the egg from the ovary. Estrogen, helps rebuild and thicken the uterine lining. Progesterone maintains the uterine lining and supports early pregnancy if fertilization occurs. You have now learned the basic science behind menstruation and periods. Stick around for part 2, where we discuss the reality of periods from common myths to basic sanitary products. If you enjoyed this video, please like and comment on what we should learn next. And remember, a jack of all trades is a master of none, but still always better than a master of one. Period. Part 2. Half the population experiences periods every month, yet misinformation about them is still incredibly common. So let's talk about the real side of periods. Now that we understand how the menstrual cycle works, let's talk about some very real things many people experience during their periods. Period pain. Many people experience menstrual cramps, also called dysmenorrhea. These cramps happen because the uterus is a muscle, and during menstruation, it contracts to help shed its lining. The body releases chemicals called prostaglandins, which trigger these contractions. Stronger contractions can temporarily reduce blood flow to the uterus, which causes pain or cramping in the lower abdomen. Some people may also experience lower back pain, nausea, headaches, fatigue, or diarrhea. Mild to moderate cramps are common. However, severe pain that interferes with daily life is not considered normal, and it can sometimes be caused by medical conditions such as endometriosis, uterine fibroids, pelvic inflammatory disease. In those cases, medical care is important. Common ways people manage menstrual cramps include heat, such as heating pads or warm compresses, gentle movement or light exercise, anti-inflammatory medications like ibuprofen, and rest and hydration. And let me put you period pain girlies onto something that works for many people. A warm bath with Epsom salt can help relax muscles and may reduce discomfort. Some people also find that lavender essential oil in a warm bath or diluted in a carrier oil for massage can help with relaxation. When cramps are really bad, I use a cloth to apply a rubbing alcohol compress. It is one of the few things that works for me, but only for a short period of time. Just remember, essential oils should always be diluted before applying to the skin, and rubbing alcohol may cause skin irritation. And what works for one person may not work for everyone. And of course, I'm not a doctor. This is just something that personally helps me. Vaginal discharge during the cycle. You know when you think you got your period, but when you check it's just the clear stuff? That's called discharge. Vaginal discharge is a normal and healthy part of the menstrual cycle. It helps keep the vagina clean, lubricated, and protected from infection. The amount and texture of discharge change throughout the cycle due to hormonal fluctuations. For example, during menstruation, you will see menstrual blood mixed with cervical mucus and tissue from the uterine lining. During the follicular phase, discharge is often light, sticky, or slightly creamy. Around ovulation, discharge usually becomes clear, slippery, and stretchy, similar to egg whites. This type of mucus helps sperm travel more easily and signals the most fertile time in the cycle. During the luteal phase, discharge often becomes thicker or creamier again. Changes in color, strong odor, itching, or pain may signal an infection and should be checked by a healthcare professional. Different types of birth control can also affect discharge. For example, a hormonal IUD may cause thicker cervical mucus, and some people may experience lighter periods or occasional vaginal dryness. Types of menstrual products. There are many ways people manage menstrual bleeding. Some of the most common menstrual products include pads. Pads are absorbent products worn in underwear. They are simple to use and stay outside the body, which makes them a good and common choice for beginners, those prone to infections, and for overnight usage. Tampons. Tampons are inserted into the vagina and absorb menstrual blood internally. They should typically be changed every 4 to 8 hours to reduce the risk of irritation or infection. It is not recommended for beginners or overnight usage. Menstrual cups. These are flexible cups inserted into the vagina that collect menstrual blood rather than absorbing it. They are reusable and can last several years when properly cleaned. Many people like this method because of the reusability, but a common complaint is that it is inconvenient and how it is tricky to use at first. Menstrual discs. Similar to cups, but shaped differently and sit higher in the vaginal canal near the cervix. Period underwear. Special absorbent underwear designed to replace or support other menstrual products. Different products work better for different people depending on comfort, lifestyle, and flow. If you are just starting your period, experience vaginismus, or have conditions like endometriosis, external products like pads or period underwear may sometimes feel more comfortable than internal options. Common misconceptions about periods. There are many myths surrounding Shark Week, like the fact that it will attract sharks in the ocean. Let's dive right into this mythical ocean. Myth 1. Period blood is dirty. Period blood is not dirty. It is simply blood, uterine lining tissue, and cervical mucus. Myth 2. Everyone has a 28-day cycle. While 28 days is often used as an average, normal cycles can range from 21 to 35 days in adults. Myth 3. You cannot get pregnant during your period. While it is less likely, pregnancy can still happen, especially for people with shorter cycles or irregular ovulation. Myth 4. Periods are always extremely painful. Some discomfort is common, but severe pain is not something people should have to live with, and it may indicate underlying health conditions, so make sure to make your voice heard and see a doctor. Myth 5. Exercise is bad during a period. In reality, light to moderate exercise can actually help reduce cramps and improve mood. Myth 6. Bleeding in a pool. Many people believe that if they enter a pool while menstruating, the water will quickly turn red. But that is not true. In fact, the water acts more as a plug when you enter a pool. The trick is to avoid entering and leaving many times, and once you leave the pool, start making your way to a bathroom to change. Menstruation is a completely natural biological process, yet it's often surrounded by misinformation. Understanding how the cycle works helps people better understand their bodies and make informed choices about their health. Every woman is different, and it is important to fight for your rights and seek answers when experiencing abnormal symptoms. Every girl should be taught how her body and systems work, and that her body is no cause for shame, period. And remember, a jack of all trades is a master of none, but still always better than a master of one. Keep learning, everyone.